Hi, I'm Amy Berline, Executive Director of the Southwestern Ohio Hemophilia Foundation, or as we call it, SWAF. I'd like to take a minute to tell you about this organization and also the incredibly heroic people living with bleeding disorders that I have the privilege of working with every day. Bleeding disorders are rare. They include von Willebrand's disease, hemophilia, platelet disorders, and a few other uncommon clotting disorders. They are lifelong, they are pervasive, and they are expensive. In fact, Forbes magazine lists hemophilia in the top 5 most expensive medical conditions a person can have. So, what is hemophilia exactly?
Hemophilia is a result of having an absence of a protein factor 8 or factor 9, and these proteins are needed in the blood so someone can have normal coagulation, or their blood can clot normally.
What most people don't know about hemophilia is that bleeding occurs more frequently internally.
Most of the time the bleeding isn't internal. Bleeds happen in the joints or in the muscles or in the subcutaneous space. Can also have bleeding in the mouth or nose or GI tract. But most often we worry about joint bleeding, and that's bleeding that happens inside a major joint. So if an elbow would bleed, besides having extreme pain, the person wouldn't be able to extend their arm. Or if an ankle or a knee would have a bleed in the joint, the person wouldn't be able to walk or bear weight.
And historically, that was the debilitating factor as the person aged.
The long-term implications for many years was becoming crippled. Patients were unable to walk after a certain amount of time because they would bleed into their joint, and the blood would destroy the synovium or the cushioning that's inside the joints. So in time they became disabled and unable to move. Their mobility was extremely compromised.
Because treatment has made leaps and bounds in the last 20 years, patients can now treat themselves proactively to keep their protein levels at an acceptable or normal level before a bleed occurs. For families, this means everything. Meet Jenny, the mother of a young boy with hemophilia. Her family was rocked when their son Paxton received a hemophilia diagnosis just days after birth.
When Paxton was born, we lived in a bubble where babies are born and they're healthy and you take them home 3 days later and that's the end of the story. But we found out about 6 days after he was born that he had hemophilia. It's a spontaneous mutation in his genes. There's nothing in our family history that would have ever indicated that was going to be the case, so it did come as a surprise to us.
In the years since, they've had some frightening experiences, and fortunately, the staff at the Hemophilia Treatment Center guided them from the start.
Within 2 weeks of his diagnosis, I was invited to come into the HTC at Dayton Children's and just learn about what hemophilia is and what the treatments look like, and just get a little bit more information about what this was going to mean for our lives. When I got in there, they also gave me information to connect with the Southwestern Ohio Hemophilia Foundation.
We exist in order for anyone who has a diagnosis of a bleeding disorder to live the life that they want to live.
Networking, education, and sometimes financial support have helped families through the years navigate the lifelong challenge of living with a bleeding disorder. Sometimes it just helps to be in the company of others who understand.
They kind of met both my needs. They met the needs of, like, here's how we're going to help you medically, and then we're going to introduce you to people that are going to be able to help you socially and emotionally with this diagnosis.
There are big decisions that come into play when you are raising a child with a bleeding disorder. Paxton is now treated proactively at home, and Jenny has taken over the responsibility of infusing him, something that happened more out of necessity than desire.
We were getting ready to go away for a trip as a family, and you can't take a nurse with you on your vacations.
Jenny's first time as Paxton's caregiver was as difficult as you might imagine.
I really liked to be the comforting role. I liked to be the one holding his other hand when he was getting that infusion, and the one that could rub his back or hold him on my lap. So the first time that I was doing it, I actually did it in an HTC, and I was the one doing it and the nurse was the one holding his hand. And that was a hard place for me to cross over.
Infusing in the home has now become just part of the family's routine.
What do we do first?
We mix it.
We mix it, and then what do we do?
We wipe it.
We wipe it. What do we put here?
A tourniquet.
Yep.
And then we poke it.
And then we poke it. And then what do?
I push it.
You push the syringe, don't you?
And I flush it.
And you flush it with the saline.
And then I put the frame on. Well, I don't put it on.
We put a gauze on there, don't we?
Yeah.
Believe it or not, by the time he's 8 or 9, Paxton will be going to camp to learn how to self-infuse, a milestone in the life of a child with hemophilia. Camp is just one of the many programs provided through SWAF. It provides an opportunity for boys to meet others with their diagnosis, take part in appropriate activities, and, like I said, learn how to self-infuse. SWAF also provides a weekend family retreat called Family Fest. While definitely a time for fellowship and fun, Family Fest is geared toward giving families all the latest information on the bleeding disorder front. It's very education-oriented. SWAF also helps families get into the Medic Alert program for the first time, a critical component for a person with a bleeding disorder. And SWAF also offers social opportunities like our fall outing at Young's Dairy, simply a chance for families to come together and catch up. There are many, many programs and services that SWAF provides to families living with bleeding disorders. Most important, we want to help each and every family live their best life possible, and we do whatever we can to assist them on their journey.
We want them to be able to continue to dream, to have every opportunity in their life that anybody else has.
And when you consider the precious lives at stake, you can understand why.
There have been a couple scary moments. There was one time that Paxton did go unconscious. He had a small head injury and he went unconscious for just a moment. So of course, with anything with head trauma, that, can be really scary circumstances for someone with hemophilia. He's stepped on a rock barefoot before and got a bleed in his foot. So, that's not something I could ever anticipate preventing.
The fact is, we can all do our part in helping Paxton and others like him to just simply be a boy.
I'm a normal kid. I like to swim.
You like to swim?
And have snow fights.
And have snow fights.
And-
You like to
and make
swim
it-
and have snow fights.
Yeah, I actually like to make a snowman too. And I like to make a wall out of snowballs.
Make a wall out of snowballs.
If you wish to learn more about the Southwestern Ohio Hemophilia Foundation and how you can help our mission, visit swohiohemophilia.org or call us at 937-298-8000.